Everyone, and welcome. We are going to go ahead and get started. So we're going to pull up our screen so that we can begin our presentation. Sarah, can you confirm that you're seeing the PowerPoint slides?
Yes, I can, Libby.
Thank you so much. Well, good morning, everyone, once again, and welcome to this Healthy Northeast Ohio webinar addressing mental health and suicide prevention. We thank you for joining us, and we're really excited to get started with you this morning. My name is Libby McGraw. I am the Regional Community Health Improvement Manager with Healthy Northeast Ohio. I am based at the Center for Health Affairs in Cleveland, and I serve as one of the local site administrators for healthyneo.org. Sarah, would you like to take a moment to introduce yourself?
Yes, good morning, everyone. Thanks for joining us today. My name is Sarah Zabo, and I'm a data analyst at the Cuyahoga County Board of Health, and I serve as the data analyst and, along with Libby, a site administrator for Healthy Northeast Ohio. So welcome.
Thank you, Sarah. Today, we will be providing some overview information about our Healthy Northeast Ohio efforts, in addition to previewing the newly added mental health index that's available on the platform. We are also joined today by Devin Althen, a prevention specialist at Alternative Paths in Medina County. Alternative Paths is a private nonprofit behavioral health agency. They are dedicated to providing an array of quality behavioral health care services designed to meet the needs of residents in Medina County and surrounding areas. We will be hearing from Devin in just a few minutes, and we are really excited to hear about some of their successful strategies to address mental health and suicide prevention in their community. Here we have some background information about our Healthy Northeast Ohio efforts. We do serve a 9-county region. Some of you may be familiar with some of this background information if you have joined us before, but for those who are new, we do utilize the Conduin Healthy Communities Institute platform. The site currently houses over 300 health and quality of life indicators. There are also demographic indicators available. And to supplement the data that is available on this platform, the site also houses several tools and resources that support program planning and implementation for community health improvement. The Center for Health Affairs and the Cuyahoga County Board of Health work collaboratively on this project. We do continue to be supported by a grant through the Health Comp Foundation in Cleveland and through partner contributions from across our region. We have the pleasure of coordinating with many hospitals and public health departments across our 9-county region, in addition to several community-based entities and coalitions. So we thank you all. If you're representing these agencies, even if you're not representative on this list, we thank everybody for their support and participation in our activities. And overall, the Healthy Northeast Ohio platform can be utilized to understand and explore the needs of a community, prioritizing needs. Data can be visualized in very dynamic ways, which you may be familiar with if you've visited the site before. And all of these can assist with taking action and ultimately influencing change in your community. We are going to go ahead and move into our data demonstration. But before we do that, as you know, today's topic is surrounding mental health and suicide prevention. And these are areas and topics of interest that continue to be priorities across our region. And this is also something that we've seen a lot in literature and publications lately. Especially there was a recent report through the CDC that outlined some youth mental health statistics during COVID-19. And just last week, there was another draft recommendation that was released from the U.S. Services Preventive Services Task Force, which outlined some recommendations for screening youth for anxiety and depression. So I know everybody who's on this call understands the importance of this topic and is very committed to addressing this as well in this space. And this is also seeing a lot of national recognition as well. So we know that you're all addressing this locally, and we thank you and appreciate your efforts. And with that, I am going to turn it over to Sarah, who is going to provide our data preview. So Sarah, go ahead and take it away.
Okay, thanks, Libby. Bear with me. I'm just going to share my screen. Libby, can you confirm that you're seeing the website?
Yes, I am seeing the homepage.
Okay, perfect. Thank you. All right, so now that you've heard some background on Healthy Northeast Ohio and Libby has set the stage for our topic today, as she said, I was just going to do a demonstration on the website of some of the mental health related data and other resources that we have available before we turn it over to Devin. So if you've visited the site recently, you're going to see that we are featuring the new Socio Needs Index Suite on our homepage. So I'm going to click on that. And if you don't navigate it to it from the homepage, you just go to Explore Data and then Socio Needs Index Suite. So this is a brand new suite that Conduent launched, I think in like mid-March. So we're really excited to be sharing this with you. And it's a tool that can be used for assessing, planning, and collaborating on community health improvement. And it can be used to identify under-resourced areas down to the zip code or census tract levels to help inform local decision-making. So as you can see, this suite does include 3 indices. So I'm just going to briefly mention 2 and then actually show you the new mental health index. So first is the Health Equity Index. If you're familiar with the site, this was formerly known as the Socio Needs Index. So this is a measure of socioeconomic need that's correlated with poor health outcomes, and it can be used to identify areas at highest risk for experiencing health inequities. And then we also have the Food Insecurity Index, which is a measure of food accessibility that's correlated with economic and household hardship. And that was released early last year by Conduent. So again, that was on the site, but it's been refreshed with updated data. And that can be used to identify areas at highest risk for experiencing food insecurity. So last is the Mental Health Index, which, as I said, I'm just going to briefly share this with you all. So this is a brand new measure of socioeconomic and health factors correlated with self-reported poor mental health. So this index combines multiple indicators into one composite score for a more holistic view of mental health. And it's calculated using a variety of indicators related to topics like healthcare access and quality, physical health status, transportation, employment, household environment, and that's all to identify areas at highest risk for experiencing poor mental health. And basically, in a nutshell, how it works is that all counties, zip codes, and census tracts are given a national index value, and those range from 0 to 100. So 0 would be low need and 100 would be high need. Then those national index values for each location in a community are ranked from 1 to 5. So 1 would be low need and then 5 would be high need. And I did want to point out, if you want to dig into this deeper, there's this icon up here that says, how does it work? So you can click on that for more details. And I'll scroll just a little bit further down. So in the map, the higher index values or ranks show a greater need to address mental health based on social and health determinants compared to either other communities in the US or within your community. So the darker the blue, the higher the relative need within the community. And I just wanted to quickly mention, if you're familiar with the site, you probably already know this, so bear with me, but the maps on the site are interactive, so you can zoom in or out, you can add labels and even change the transparency, and you can download them. But I did want to point out in these indices, just below the maps, you're going to see options to filter. So you can filter by a particular county. So I'm just going to select Medina since that's what Devin's going to be focusing on. And then you can either select zip code or census tract. And again, you can zoom in. So I did just want to point out that feature. And then below that, you'll see a graph of the data as well as a table. And I did just want to share a couple ways in which you can use this index. So it provides obviously a visual of mental health in your community. And because the data is available at a sub-county level, it allows you to be more specific when planning local prevention and intervention efforts. And then it also can bring cross-sector partners together by identifying areas for shared action around addressing mental health and access to mental health care services. And then lastly, it can also help to inform policies and interventions at more of a regional level. So again, I know that was kind of brief, but we do hope you navigate to the site to check out this index. Again, we're just really excited to share this with you. So in addition to the mental health index, I also wanted to just quickly highlight some of the other mental health related indicators that we have on the website. So to do that, I created just a quick custom dashboard that you could create yourself on the website. And I just picked, again, Medina County for sake of example, and I'm highlighting indicators from our mental health and mental disorders topic area. So again, you can see these are the indicators that are available within that topic area for Medina County. There's quite a few. And you'll see that, the indicator names on the left. The second column will have the current value as well as the measurement period listed. And then to the right are any comparisons that are available. And then I also wanted to mention we do have additional indicators that would be related to alcohol and drug use that I didn't include here, but we know that substance use can contribute to risk for mental illness and suicide. So those might also be important indicators for you to look at just to get a more holistic approach. And then I did want to just click on one indicator again, if you're newer to the website. So I'll pick age-adjusted death rate due to suicide just to show you how to dig deeper. So if you're more interested in learning about this indicator, you could just click on its name and you're taken to what's called the indicator detail page. So this is where you can read all about the indicator. So you can see a description or definition of the indicator, a description of why it's important, again, the current value, some additional details about where the data is coming from and who's maintaining it. You could see a change over time graph and then any breakout data that might be available for the particular indicator. And I did want to mention that you can also download data on the website. So in addition to the mental health data that we do have available on the website, you can also combine this with other information and resources we have. For example, our Promising Practices database. We also have a resource library and funding opportunities. So once you've looked at the data and you've maybe identified a need or area of improvement in your community, you can use this database to look up successful programs to potentially implement. So this database includes more than 2,000 practices that Conduent ranks from a good idea to an evidence-based practice. So I just did a really quick search. I just selected evidence-based practices, and then down under topics, I selected mental health and mental disorders. But you can see there's additional filtering options if you're looking for information around a particular population. So then, the list appears, and if you're interested in learning more about one of these evidence-based practices, you can just click on the name, and you can even get contact information who may have, for the person who may have developed it. So I did want to point that out. And then lastly, this is found under our Tools and Resources tab. We do have a resource library and funding opportunities that I mentioned. So our resource library contains nearly 400 community health resources that we have organized into collections. So those can be like websites, reports, articles, etc. And then our funding opportunities database allows you to search for grant announcements, mainly from large foundations and the national government. But if you were interested in looking at funding opportunities related to mental health, you could check that out. So that concludes the demo for today. So I'm going to go ahead and stop sharing. And I will turn things over to Devin from Alternative Paths, who's going to be talking about mental health awareness and suicide prevention efforts in Medina County. So Libby, I know you're going to pull up her slides and then take it away, Devin.
And then if somebody, either Devin or Sarah, if you could confirm that you're seeing my PowerPoint slide, I will go ahead and go back on mute. Okay, great. Take it away, Devin. Thank you. Thanks, Sarah.
So thank you guys for inviting me today. My name is Devin Alton, and I am the prevention specialist with Alternative Paths in Medina County. And so what I do in my role is everything I do is out in the community. I teach on suicide, drug addiction, and gambling addiction. And typically it's to individuals who may have a family member who is struggling with these sort of things or something like that. It's not usually the individual who is diagnosed, but it's those who might be recognizing warning signs in somebody else, things like that. And so today I kind of want to talk to you guys about just what Medina County has been doing as a whole when it comes to outreach efforts in mental health and suicide awareness and things like that. So we can go ahead and go to the next slide. So first, I really wanted to highlight the collaboration within Medina County. It's something that I was very surprised about when I first started in Medina, to see how willingly all of the different organizations actually do try to collaborate on these sort of things. And the best way that I can kind of highlight this is to talk about the Suicide Prevention Coalition. And so even outside of the coalition, all of these people will collaborate. But if you look at the coalition specifically, we have everything from physical health, where the hospital is represented, the health department, the Board of Developmental Disability is represented. We have healthcare sectors from the ADAM Board, which is the funding agency for a lot of the mental health resources in our county. And then AP, Belfair, Ohio Guidestone, these are all the boots on the grounds, right? These are the people who are actually giving out the services to those who need help. And then we have businesses that collaborate. So we have a couple of the chambers who come. Sometimes there are banks and places like that that come and sit with us and figure out ways to collaborate. Then we have the schools. So I put Hope Squad on here, which we will talk about here in a few minutes. The Career Center, local schools, those are all people who are very willing to figure out the best ways to not only reach the students, but the parents, things like that. And then we have law enforcement. So in our coalition, we have multiple different police agencies that sit down with us. We have the courts. There's a lot of judges on the courts. They're very involved within Medina County. We have drug court, mental health court. The juvenile detention center is very involved. And so when we talk about mental health, I'm not just talking about the individuals who provide the services like AP, Belfair, and all of that. I'm literally talking about the entire county is trying to figure out how to meet the needs of those that they serve, because they realize how important it is to take care of the mental health issues, and then everything else will kind of start taking care of themselves. So just to kind of show you how willingly everybody is to work together on this topic, I think is something that's big to kind of highlight in Medina County specifically. We can go to the next page. So when I talk about the interventions that we have for mental health, I look at it in the prevention, the intervention, and then the postvention. And so the prevention, we're really looking at the community as a whole. We are looking at who's most at risk and how do we reach them. And this is obviously before there is a need that needs to be met. It's just how do you make sure that everybody knows kind of what the resources are out there. And then we have the intervention, which are the services, the crisis line, CIT, all of those sort of things. And then you have postvention. And so postvention is after we have the initial intervention and all of that, kind of how do we sustain these resources for those who utilize them. And so we have the LOSS team, which I will also get into here in a moment. We can go to the next slide. So we're going to start off with prevention initiatives. So the first one I want to talk about is QPR. And so QPR is Question, Persuade, and Refer. And this is an evidence-based program. And essentially the creators of QPR thought, okay, we have a large number of individuals who have been certified in CPR, right? We all know that if somebody goes into cardiac arrest, we're able to take a couple steps in order to keep someone alive long enough for a medical professional to intervene, right? And so those who created QPR were like, well, if we can do that for a physical issue, why can't we create something that's similar for a mental health issue? And so they created Question, Persuade, and Refer. And I teach individuals basically how to ask the question, right? What are appropriate ways to ask it? What are inappropriate ways to ask about, are you suicidal? Are you thinking about hurting yourself? Things like that. Then how do we persuade them to stay alive, right? What do we say in order to convince them or persuade them to get help? And then where do we refer them? What sort of referral sources do we actually have within our means, within our county, and things like that? And so this training is only an hour and a half. It is something that allows us to teach the layperson what the warning signs from suicide might be, what behavior should we look for, what verbal clues or situational clues might we recognize in someone. And the really cool thing about QPR lately is that, so Leadership Medina County is an organization that takes leaders in the county and puts them through a class for a year. And so this year, their class decided that they saw mental health being a very big issue within our county and that they wanted to figure out a way to address it. And so we have actually given out, I want to say 6 or 7 free trainings to individuals in the county on QPR. And it started a lot of conversation just about mental health and what that looks like and how to actually get resources. And so this is a really good program to be able to start that conversation and give people a tangible way to actually be able to intervene if they're noticing somebody is struggling with mental health or suicidal ideations, things like that. You can go on to the next slide. So another form of prevention that we implemented in Medina County is called the Hope Squad. And this is actually a branch off of QPR. And so what the Hope Squad is, it's a peer-to-peer evidence-based program that we implemented in the schools. As of right now, it is in Medina City School, Cloverleaf, and Buckeye. And so basically what this is the organization recognized that there are children within the school who kind of always have the conversations about the hard topics, right? They're the children that the students feel very comfortable coming to talk to them about things that are happening in their lives that might be too heavy for a child to actually handle or know how to handle. And so in 6th grade, when the students go into the middle school, they nominate 3 individuals who they feel comfortable speaking with about the hard topics. And they submit these anonymously, and the school kind of starts collecting all of the names. And what they realize in the schools is that there are names that show up over and over and over again. There are a select number of kids that almost everybody feels comfortable having these conversations with. And so what they do is they invite these students to be a part of Hope Squad and also invite their parents to be involved in kind of knowing what Hope Squad does and all of that sort of stuff. And so these students, when they're on Hope Squad, they are given the resources to have these difficult conversations and then get them to adults who are able to actually help. And so once the students are decided, they receive a 9-month curriculum. The very first thing that they will learn is QPR. And then they learn things like self-care, anti-bullying practices, all of those sort of things. And their intention is not to replace the counselor, right? They are not there to become counselors or anything like that. They're merely there to have the conversation and then bridge the gap between a concerning conversation and seeking assistance from adults. And so these students have access to their counselors 24 hours a day, 7 days a week. It doesn't matter if they are on summer break, weekend, in the middle of the night, things like that. They're able to connect to an adult who's able to then assist somebody. And their only purpose for being on Hope Squad is really to identify the students who are at risk, provide friendships to them, and then get them to adults who are actually able to provide the assistance. And so we have noticed that in the high school and middle school level, this has been very helpful. I love being able to hear the stories that the students share about what it sort of experiences they have around Hope Squad. And I think the thing that people fear the most is, well, isn't this too heavy for kids? And I understand that that is a fear, but the other thing that we have to remember is that these are the kids who are already having these conversations. And so this is just now giving them the opportunity to have other resources, other adults who are able to kind of help and intervene when they feel like their conversation is too heavy for them to handle. We also are now starting to implement this in the elementary schools. In Medina, theirs is more about just being a good friend, kindness, and that sort of stuff. But it is starting to grow even beyond the middle school and high school years. You can go to the next slide. And then we have outreaches. And so when COVID hit, we recognized that trying to reach individuals in the ways that we previously were able to was obviously going to become very difficult. And we started creating very innovative ways to make sure individuals knew what resources were available in Medina County. And so we started thinking about all the different populations and how we were able to reach them. And so one of the things we created was an air freshener. We've given these out at car washes. We've given these out at oil change places. This is just a way for us to reach populations who might not come into a brick and mortar building and get the rec cards that we created and things like that. And so we were just trying to figure out ways that would reach individuals who don't come to things that we have thought of before. And then we created a bag that we gave out to food pantries because we recognized that pantries were starting to get used a lot more during COVID. We created jar openers, magnets, sticky notes, things like that. The elderly population absolutely loved it. So being able to reach that population was something that we were able to do. We can go to the next slide. We then started thinking about that in Medina County, the most at-risk population is actually middle-aged men. And so how do we reach that population when it's so hard to actually be able to reach? And so these are a few of the ideas that we came up with. One of them was a coaster. And so we recognized that during the Super Bowl time, there is probably going to be a lot of gentlemen who go to the bars and watch games, things like that. And so we created coasters and gave them out to about 20 different local bars within the county. This is actually our second outreach when it comes to coasters, and both times it has been really well received. There have been many bar owners and bartenders who have said that they have watched individuals actually stick the coasters in their pockets and take them home with them. And so knowing that this is something that did reach the population we wanted them to reach, I think is really, it's just a blessing that we were able to reach them. And then we created gun cloths because we recognized that firearms is a very common way that somebody might have suicidal ideations with. And so we thought if we created a gun cloth, then whenever they utilize their guns or cleaning them or things like that, they then have their resources right there. And so we've given these out at gun ranges. We've given them out to all the officers in the county. They've also been really well received. And then we created clings because when we were thinking about how we could really have a captivated audience, we recognize that when you or when a gentleman uses the urinal, the only place you can look is forward, right? And so we figured if we created clings that go on the walls that could be easily removed and transferred and that sort of thing, then at least there's the resource right there that anybody is able to utilize as they see fit. And so those are some of the ideas that we had for reaching middle-aged men. We can go to the next slide. And then a couple of the other ideas is we do a youth poster and sticker contest. And so the poster that you see at the bottom was our first place winner from last year. The poster contest is the middle schoolers, and then we previously did a video contest for the high schoolers, but now we do a sticker contest. And so these are basically posters and stickers that revolve around seeking help if you have thoughts of suicide or depression or things like that, and really emphasizing the crisis lines that are offered to individuals within our county. If you look over on the other side, you see the crisis line stickers. And so these are ones that we created generically. However, we just finished our contest for this year. And tomorrow we will be announcing the high schooler whose crisis line sticker will then be the new face for this for next year. And so we've put these out on pizza boxes, we've put them out on other to-go boxes, and it's just a way that we can be able to reach people in a large quantity that maybe we weren't able to reach before. And then lastly, in the middle, one of our outreaches was creating masks, and the masks just say "Life is tough, so are you." We gave these out at the schools. And so when the students had to wear a mask at school during COVID, they had something to remind them that we're all going to get through this. So those are some of the outreaches that we were able to implement within the last few years when it comes to suicide prevention and just mental health. Go to the next slide. So next we're going to talk about intervention initiatives within the county. So firstly, we have the crisis line and then our local services, right? And so obviously when we talk about local services, there are a large array of different services that we can offer to the community, right? So if you look on the right-hand side, you will see a virtual copy of our RAC cards. And so these RAC cards were created because we recognize that the ADAM board funds many different organizations in our county, but a lot of individuals who just don't work within the mental health field or things like that are just not aware of what resources are actually out there. So we created one RAC card that explains down to very specific details of what each organization is able to help with and all of that sort of stuff, so that if we have individuals who are looking for resources with a youth who has a mental health issue or a drug addiction issue, things like that, then you know exactly where to turn to and don't have to call all these places to figure out what would be most appropriate. And so when we were looking at these, we our main focus was getting the community just the knowledge of what services were actually offered when it came to mental health, addiction, and crisis services. And then the second piece of the intervention was actually our crisis line. And so a few years ago, we looked at the crisis line and recognized that if you call it simply a crisis line, a lot of people will not call for resources because they view it as, I'm not in a crisis, why would I call this number? And so we kind of changed the name to a crisis and behavioral health helpline so that people understood that you don't have to be in a crisis to be able to utilize this line, right? You're able to call because you need resources and you don't know where to turn. You don't know what would be the most appropriate place for you and that sort of stuff. And so our numbers in 2021 have definitely been on the rise when it comes to the utilization of our crisis line. And I think it's because now people are just more comfortable to be able to have those conversations, as well as knowing that the line isn't there strictly for when you're in crisis, but also for when you just need resources and things like that. We can go to the next slide. Another form of intervention that we have really done a lot within the county is the CIT. And so CIT stands for Crisis Intervention Team, and these are police officers. And so Medina County has been offering CIT to our officers since 2003. We have over 400 Medina County officers that are CIT certified. These are road officers, dispatch, corrections officers, and this is actually 90% of all of our law enforcement officers within the county. And so what CIT is a 4-day training that basically teaches officers how do you handle a situation that is mental health related when you're out in the field, right? So if you encounter somebody who has schizophrenia, how do you appropriately manage that situation? If you have somebody who has severe depression or suicidal ideations, how do you appropriately manage that? And so all of our officers have gone through, or the vast majority of our officers have gone through this training, do role plays, things like that. They're able to see the mental health hospitals and interact with those who are then kind of able to fill the gaps between what they're able to do and the services an individual might need. And so through the CIT, we created the CIT portal. And so if you go to Alternative Paths webpage, you will see up in the corner here, we have CIT referral. And basically what this is it's a referral form that law enforcement can use to make a non-emergency CIT referral. And so basically, if they interact with somebody who they would love for a mental health professional to follow up with, they will insert all of the information that they have into this portal. And within 24 hours, a mental health professional who is on our crisis team will then follow up with the officers and with the individual who they're looking to make sure has the resources that they need. At the same time, if an officer is on scene and they realize that this is a situation that they just don't know how to handle, or that a mental health professional would just be better at, they are able to call our crisis team and collaborate with them in the moment while they're on scene and be able to have that resources available for them whenever they need it. For the individuals who've gone through CIT, one of the final steps for them after they have become CIT certified is to actually do a ride-along with a mental health clinician. And so these ride-alongs are typically about 4 hours, and Audra and Gail within our organization will actually sit in with them as they go to their different scenes, see how they handle it. A lot of times there have been calls where the mental health professional was needed in the time of the ride along. And so being able to have those interactions and the officers are able to ask the questions that they have and all of that has become very important actually in just allowing them to feel comfortable in what it is that they learned through the training of CIT. Each year we recognize a CIT agency. And so you see down at the bottom, this is Wadsworth. They got the award this year for being the CIT agency of the year. And then we also added a mental health clinician to our county crisis negotiation team. So as the officers go out to crisis situations and have to do negotiations and things like that, it's no longer just law enforcement that are going out, but it's now also a mental health clinician who is able to be on scene and make sure that these things are being handled appropriately if it comes to mental health. Next slide. So the next thing we're going to talk about is postvention. And so postvention, we recognized that when we talk about suicide, that for those who have survived a suicide loss, it is really difficult to find resources for them to figure out who it is that we should be reaching out to, things like that. And so what we created in Medina County is local outreach for suicide survivors, and we call it our LOSS team. And so this started, I believe, in Franklin County in Ohio, and we were able to now implement it in Medina County. And the way we run it is that there are 13 clinicians that are on call 24/7. And so police officers, when they go to a scene of suicide, what they recognized was that a lot of times the suicide occurs in a place where the family is, right? Whether it's at their house or someplace they frequent, things like that. And so the police officers are on scene, but their job is to make sure that the scene is processed. And as they're doing this, they recognize that, okay, there's a family here that we want to support, but we're not really able to because we don't have the means to be able to do that, because once we're done here, we're going on to the next call and all of that sort of things. And so we created the LOSS team so that whenever there is a suicide in Medina County, the same way that the coroner is dispatched and law enforcement is dispatched, one of our clinicians is also dispatched on scene. And so while our clinician is on scene, we are not there to provide counseling. The only thing that we are there to do is provide support to the family and to be able to give them resources. And so when I arrive on scene, my questions to them are things like, do you need me to call family members? Like, do you need support around? Who can I call to make sure that you are not here alone? Do you need me to help you pick a funeral home? Can I make you a sandwich? Like, when people go through very traumatic times, you're not really like there trying to remember just the basic needs that we have. And so just giving that very tangible, basic support for somebody is so crucial in these times. And so when we show up, We also have a packet that has all of the resources in Medina County and what it is that we are able to provide for them. But what we recognize is that studies show that individuals who are a survivor of suicide, it typically takes them about 4 years before they then follow up with any sort of counseling or things like that. And so we leave these packets saying, I understand that you're probably not going to need this right now, but when you're ready, just know that there are resources available and this is where you can find them. And so this has been very well received in the county by both law enforcement and coroners, as well as the families who we've been able to support. And we also make sure that we follow up within the few weeks after to see if there's anything else that we are able to help them with. But that's kind of just all the different resources that we have been able to implement in Medina County. You could actually go just to the last page. So if you guys have any questions over kind of what I've spoken about or any of the things that we were able to create, implement, things like that, that's my information, and I would love to be able to chat with you.
Thank you, Devin. Thank you so much. And I'm going to leave this slide up for a few moments while we're concluding and asking for questions, just in case anybody would like to take down Devin's contact information. But wow, this is really great information. I think it's very exciting to hear about the very creative ways you have been able to implement a lot of these interventions and prevention outreach efforts and things like that. So if anybody has questions, please go ahead and add those to the chat box. And Sarah, if you wouldn't mind keeping an eye on those. I do have a couple questions for you, Devin. I know we're getting close to time, so I think I'll just pick one of them. We did have somebody ask about receiving a PDF, and we will share these slides via PDF in the webinar follow-up. So we'll also include a recording of this link. So if you have partners or anybody in your own agencies who you would like to share this information with, you will receive that later today. One of the things that I am feeling pretty connected to in relation to your presentation, Devin, was the power behind collaboration. And even though in Northeast Ohio we have a lot of variety, and county to county, our populations might look different, and we might have different demographics and things like that. But I think the resounding consistency throughout all of our communities is that collaboration is really important. So my question would just be if you can talk a little bit about maybe one example of a really successful collaboration that you observed that maybe surprised you.
Absolutely. Let's see. I think, honestly, I view two. So one of the collaborations that surprised me is that in Medina County, they have something called Share Cluster, which is where all of the schools come together and send a counselor to a monthly meeting. And on top of that, all of the different organizations within the county, whether it's library, mental health organizations, the health department, places like that, they all come together and they have a monthly meeting about what it is that children are experiencing, what it is that schools are experiencing, and how people are able to actually tangibly help with these in the moment and all that sort of things. And they create different outreaches for the kids that are countywide, not just specific to one school. So I think that seeing all of that collaboration has been one of the most eye-opening for me, to be able to just watch how many people are coming together, making sure that our kids have what it is that they need. And then the other one is actually with the health department, their Living Well Medina County collaboration, because there's 6 different sectors that they're kind of focusing on, and being able to bring together anti-bullying and heart disease and all of that, and bring it to the table and be able to address what it is that people are doing or might be experiencing negatively within their lives as a person as a whole, instead of just one piece at a time. I think it's been really cool to be able to see kind of come to fruition as time goes on.
That's great. Thank you so much. Well, I'm sure we could talk about these things all day, but there was one more question in the chat, and that was about if there are similar programs available in Cuyahoga County, and if so, who implements them. So I know we had individuals from across our regional footprint that registered today. So if anybody has any feedback that you could add to that question in the chat. And then Sarah, I know that you're at the Board of Health. Are you aware of similar programs? I would also assume that maybe through the local ADAM board for Cuyahoga County, that there might be similar efforts such as the ones that Alternative Paths might work with their local ADAM board on. So Sarah, I'll let you take a moment too.
Yeah, I'm actually not 100% sure on that, but I was going to suggest the Adams board as well. And Devin, I don't know if you're familiar with other counties offering similar programs or services to what you're offering. And we could even try to look into this and add that to our follow-up.
I actually am not sure. I do know that Cuyahoga County does have a suicide prevention coalition. I actually am working with them on a grant right now. So honestly, that might be the first best step of being able to find what resources are in the county. But I could always give you guys their contact information if that is something that you want.
That'd be great. Thanks, Devin. And we can share that out afterwards as well. So thank you, everybody, for the participation in the chat. If there are any other outstanding questions, do feel free to add those. We are going to go ahead and start our conclusion. So thank you again, Devin, for your time and for that wonderful overview. Again, I think it was really powerful to hear about the creative ways that Alternative Paths and a lot of your local partners have been able to collaborate to address preventing suicide and addressing mental health as well. So we appreciate that. We have a couple of upcoming opportunities we did want to mention before we wrap up today. So we have our spring regional convening, which will happen a week from today, next Thursday, April 28th, and this will start at 9 o'clock. And we have registration open and available, and that registration link can be found on our homepage in our What's New section. And we invite you to attend. This is our third spring or our third regional convening, and so we're excited to bring together partners to talk a little bit about CHNA, status updates. We'll have a guest speaker from the Northeast Ohio Black Health Coalition, and we're really looking forward to that event. Next month, we will also be hosting another webinar similar to the one today, and this will be in conjunction with the local American Heart Association, and we are going to be focusing on strategies to improve stroke awareness. So we also invite you to join that as well. We will likely start promoting that in about another week or so. And with that, if you have any questions or would like to get in touch with myself or Sarah with any requests or, again, just feedback, general questions, concerns, please do feel free to contact us through either the Contact Us page on our website or through email. And that concludes our webinar today. So thank you again, everybody, for your participation. We appreciate your support, and we hope you have a great day.